don't know me, I'm Ros Jones, I'm Mayor of Doncaster, and I would like to welcome all to this virtual meeting. Members of the board present at today's meeting are, and I'm going to read the whole list of people who are normally there, and then people will tell me when they're substituting, when I ask them to introduce themselves, if that's okay. So the Vice Chair is Councillor Nigel Ball.
Afternoon, Mayor.
Afternoon, Nigel. Deputy Mayor Councillor Glyn Jones.
Glyn's not down to attend this meeting, I am.
So
Ross. Glyn's not down to attend this meeting, it's me.
Oh, it's down on my list to attend, but that's okay, no problem.
Okay.
Councillor Jane Cox. I'm sure I've seen Jane.
Yes, yes.
Hi, Jane.
Hello.
Councillor Andy Pickering.
He's not joined us yet, Mayor.
Okay.
While I'm speaking, for Mayor, Tim Brown has now joined the meeting. He is now part of the meeting.
Okay, thank you. Councillor Nuala Fenley. I've heard Nuala.
I'm here. Yeah, I'm here.
Councillor Chris McGuinness.
Yeah, good afternoon.
Councillor Jane Nightingale.
Yes, I'm here. Good afternoon, everybody.
Damien Allen.
Afternoon, Chair.
Afternoon, Damien. Going on. Dr. Rupert Suckling.
Yeah, afternoon, Ros.
Afternoon. Caris Williams.
Yep, I'm here. Good afternoon.
Good afternoon. Sean Morley.
Yeah, good afternoon.
Good afternoon,
Good
Sean. Shane Totty.
Yes, afternoon, Mayor.
Afternoon, Dan Fell.
Hi, Rose.
Hi, Jackie Pedersen.
Afternoon, everybody.
Dolly Agoro. I've seen Dolly, I'm sure. Yeah, hi, Dolly. Fiona Campbell.
Afternoon, all.
And I know I've got down here as Paul O'Brien, but we've got a substitute for Paul, who's Marvin Beaumont. Yeah.
Yeah.
And I've been told the three members of the public attending, Tim Brown, Olivia Jones and Arnold Tiesh.
Afternoon, Mayor. Afternoon, everybody.
Afternoon.
And member of the press, George Tor.
He's not joined us yet, Mayor.
He's not joined us. Okay. We also have a number of officers present from Doncaster Council who are in attendance to support the meeting and to respond to questions from board members in relation to the items on today's agenda. So I will now ask board members and other attendees to introduce themselves so that we know everyone is here collectively with their titles. So if I go with yourself, Nigel.
Afternoon, Ross. Councillor Nigel Ball, Cabinet Member for Public Health, Leisure and Culture.
I had got Glyn down here, but I'll go past that. Jane, Councillor Jane Cox. Hi, Jane. Are you with us, please?
She's not muted. I don't think she is. Oh, sorry, Jane Cox. Do apologize. No, Jane Cox. I can't see. I don't think she's.
I've seen her come in.
Have you? Right. Thanks, ma'am. Just
She answered.
Oh, she's here. Hi, Jane.
Yeah, she is there. Sorry.
Thank you.
Jane.
Councillor Andy Pickering.
Andy has not joined, Mayor.
Okay. Councillor Nuala Fenley.
Yep, Councillor Nuala Fenley, Cabinet Member for Children, Young People and Skills in Doncaster.
Councillor Chris McGuinness.
Afternoon, Cabinet Member for Communities, Neighbourhoods and the Environment.
Councillor Jane Nightingale.
Good afternoon, everybody. I'm Councillor Jane Nightingale, Cabinet Member for Customer and Corporate Resources.
Thank you. Damien Allen, sorry.
Thank you, Ros. Damien Allen, Chief Executive of the Council.
Dr. Suckling.
Yeah, Dr. Rupert Suckling, Director of Public Health at the Council.
Caris Williams.
Yep, Karis Williams, Public Health Improvement Officer at Doncaster Council.
Chief Superintendent Morley.
Yeah, I'm here, Ross.
You're here, thank you, Sean. Shane Totty.
Yeah, Shane Totty, South Yorkshire Fire and Rescue. I'm the District Commander for Doncaster.
Thank you, Shane. Dan Fell.
Hi, Chief Executive, Doncaster Chamber of Commerce.
Thank you. Jackie Pedersen.
Hi, yeah, Jackie Pedersen, Accountable Officer for Doncaster CCG.
Dolly Agoro.
Hi, I'm Dolly Agoro, Chair of Inclusion and Fairness Forum.
Thank you. Fiona Campbell.
Sorry, on mute. Union representative for NEU Doncaster.
Okay, thank you. I've got Paul, but it's Marvin Beaumont.
He's on mute, Chair.
Sorry. Marvin Beaumont representing GMB.
Thank you. Tim Brown.
Tim's on mute again, Chair.
Yeah, Tim Brown, community activist in Doncaster.
Thank you. Olivia Jones.
Hiya, Olivia Jones, community activist and lead organiser of Black Lives Matter Doncaster.
Thank you. Arnold Gesh.
Yeah, Arnold Chege, resident, local resident, Doncaster, present.
Thank you. And John Gleek, is John with us?
No, he sends his apologies, Chair.
I'm here instead of him, Mayor. I'm Laurie Mott. I'm a strategy performance manager with PIC.
Thank you very much. So may I point out that the microphones of external attendees, such as members of the public and the press, will be muted during the meeting, apart from when they are putting their question to the board. If anyone intends to record today's meeting, please ensure that this does not disturb the conduct of the meeting, and please ensure your mobile phones are off or switched to silent mode. And thank you all. I will now commence the meeting. So first of all, we've had our apologies stated, haven't we? And we've got the people who's attending in their place. So we move on to item 2, exclusion of the public and press. There are no items on the agenda where the public and press should be excluded. Is that agreed?
Agreed.
Thank you. Item 3, public statements and questions. We've received 3 questions from members of the public. Now, as all 3 questions are similar in nature, I will ask them to put the question and then I will respond to them all collectively. So the first that I've got is Mr. Brown. Mr. Brown, would you like to put your question, please?
You're on mute, Tim.
Okay, let me just find my question again. Yeah, I'm with you, Mayor. My question to you is, the World Health Organization defines social determinants of health as the conditions in which people are born, grow, live, work and age. Sir Michael Marmot's review highlighted life expectancy outcomes are worse for Black communities. The DMB BME Health Needs Assessment has been neglected. We now know that £500,000 that was allocated for a BME Learning and Leisure proposal as part of Professor Gus John's report has gone missing. The agenda item number 7 report is positive, but I see no sustainability plan. I respectfully ask Mayor Jones to work with Black citizens to co-produce specific actions to address they acknowledge structural racism, discrimination and racial inequalities, including culturally appropriate services and a team Doncaster workforce of at least 5% black citizens. Thank you.
Mayor, may I just interrupt? I do apologise. Councillor Fenley's hands up, but I wonder whether she wanted to speak or not, or it's just she wants to. Yeah, I think it's
No,
got.
sorry, I put my hand up to say that we can move on when Ros asks, because we've always indicated that we put a hand up if we want to agree with her. So I just put my hand up for that reason. Okay.
I do apologise. Sorry, Tim.
Okay. It's all right.
That's okay. Thank you for your question, Tim. I'm going to ask Olivia Jones now to put her question, please.
Okay, hello. So, as per the report commissioned by the Public Health England, Black, Asian, minority ethnic communities are disproportionately being affected by COVID-19. And after you so publicly took the knee in support of Black Lives Matter, I'd just like to ask how, going forward, the council plans to support Black, Asian, minority ethnic citizens and communities in terms of healthcare. And I'd also like to ask how this is going to carry over with regards to job opportunities, as Black, Asian, minority ethnic citizens only take up 5% of the workforce in Doncaster. We don't actually have the figures for specifically Black workers, and also how that's going to carry over in regards to tackling racism in the workplace.
Thank you. And Arnold TH, please.
Yes, thank you, Mayor. My question is, what sustainable actions are to be implemented to address this intersectionality within the recommendations of the recently conducted BME needs assessment by DMBC and the recommendations from the Public Health COVID report? And various reports have identified the inequalities in social conditions, i.e. deprivation and racism, as contributing factors to the increasing COVID-19 death, especially within the BME communities. And the question comes in, what short-term and long-term actions will be implemented by the council, the local authority, that's DMBC, in tackling this ever-present structural racism within DMBC to support equity in terms of service provision and access by the local people?
Thank you, Arnold. And my response to the three questions is as follows. There is clear evidence that COVID-19 does not affect all population groups equally. Public Health England have published a rapid review, Disparities in the Risk and Outcomes of COVID-19. This report confirmed that the impact of COVID-19 has replicated existing health inequalities and in some cases increased them. Their second report focuses on stakeholder views, gathering insights into factors that may be influencing the impact of COVID-19 on these groups. The report, Beyond the Data, Understanding the Impact of COVID-19 on BAME Groups, contains 7 recommendations. In our local response to COVID-19, we have focused attention on providing education and prevention resources in suitable formats. Within our COVID-19 outbreak control plan, we have included work to support the local implementation of the Public Health England recommendation. Fund, developed and implemented culturally competent COVID-19 education and prevention campaigns, working in partnership with local BAME and faith communities to reinforce individual and household risk reduction strategies. We built trust with and the uptake of routine clinical services, reinforce messages on early identification, testing and diagnosis, and prepare communities to take full advantage of the interventions, including contact tracing, antibody testing, and ultimately vaccine availability. Agenda item 7 sets out in detail our local approach to ensure we actively address Public Health England recommendations, and we have cross-referenced these in the local 2017 BME Health Needs Assessment work. This report has been developed with the Minority Partnership Board, which has been convened during the pandemic and has been meeting virtually every 2 weeks. We are committed and remain committed to cultivating a philosophy of equality, diversity and inclusion. Over the last few years, Doncaster Council and partners in Team Doncaster have worked towards deepening its level of understanding and improving the ways in which we listen to what our communities are telling us. There is always room for further refinement as we continue to understand our community needs and reflect these in our responses. As part of COVID-19 Test and Trace Support Grant, we will recruit a COVID Community Link Coordinator and 2 COVID Link Officers, Minority Ethnic Engagement, to ensure we are in a position to listen to the BAME citizens and take action. This will also enable to actively address circumstances where there is intersectionally, where 2 or more dimensions of inequality overlap. Whilst I'm not in a position to make a commitment on behalf of Team Doncaster Partnership, I do know that the Fair and Inclusion Forum and Doncaster Minority Partnership are drafting a statement that all Team Doncaster partners will be asked to sign up to that demonstrates a clear commitment to tackling inequalities. Team Doncaster will consider this statement soon. In terms of our workforce, we use all minority groups in our calculation as they are subject to the racial characteristic and can equally be the subject of discrimination. The Equality Act definitions of race states that race can mean your colour or your nationality, including your citizenship, can also mean your ethnic or national origins, which may or may not be the same as your current nationality. If we remove the white, Irish, European and white other, then our minority percentage is 3.3. This equates to 104 colleagues. Please note, however, that we still have 21% of the workforce where we do not have data, so this figure may not be truly representative of our actual workforce. We have an inclusive employee forum where employees from all different diversity groups have a say in matters that affect them and actively promote inclusion through a range of staff diversity events. Black History Month, Holocaust Memorial Day, World Day of Cultural Diversity, World Religion Day, Gypsy, Roma and Traveller Month, as well as National Inclusion Week. We regularly promote equality, diversity and inclusion through leadership communications to staff, and our staff themselves promote it at events and have come together to produce an inclusive employee video. Our work as an employer has been recognised, and this year we have had our employment provisions assessed and achieve inclusive employer status. We also work hard to provide opportunities to enter employment. We offer insight days for people to come and find out about the council, our jobs, apprenticeships and how to apply. We are a cornerstone employer working with schools to promote local government careers and have a gold standard accredited scheme to allow people to get experience and develop skills to enhance their employability. Information about our jobs, work experience, volunteering and apprenticeships can be found on our website. Just search Doncaster Council jobs. We also have a Doncaster Apprenticeship Facebook page where we post our events and activities. We will continue to promote and enhance these provisions to provide opportunities for all staff and also Doncaster residents, including BAME and other minority groups. Team Doncaster is also looking to reflect in its post-COVID-19 operating model, Mayoral Restart Recovery and Renewal Plan, a deeper and more centralised focus on tackling the inequalities, disadvantage and racism that exists within the borough. The unprecedented emergencies and crises we have faced over the past 8 months have brought a new urgency and immediacy to this. Indeed, these crises have accelerated our understanding of each other and they have brought out the best in our borough. Never have public services, volunteer groups and businesses been more stretched, or it has been more important that collaboration has deepened. Communities have come together, supported each other, and partners have come together more closely than ever. For example, the COVID Fighting Back support included food bank activity, virtual choir sessions, art and craft packs, and an incredible amount of work around caring for our community to ensure that people were safe and well. BAME groups naturally stepped up to the plate and were there when our community needed them. Of the 244,450 of grant support, 48,347, just under 20%, going to support residents in the BAME communities. No single organisation can change things, and all partners from all sectors are determined to continue to work in this way as we emerge from this pandemic. As we refocus and turn our attention to the long-term recovery of the borough, we have an opportunity to consult, engage and increase our understanding with a sense of renewed vigour and continued commitment to ensure all our communities thrive. Now, I will provide you with the opportunity to ask a supplementary question. Mr. Brown, do you have a supplementary, please?
Tim, you're on mute.
Yes, I do. I've heard what you've said, Mayor, but I've been around asking questions around equality, diversity and inclusion for over 25 years. And to where you articulate that the diversity of Doncaster Council's workforce remains 97% white is a real concern. And it's a concern, you know, as a parent, you know, who's got 2 children in Doncaster, I haven't seen any change in terms of opportunities for our young people. And then linked to that, Mayor, I'm mindful that, as you've mentioned, there is a, what do you call it, restart, recovery and renewal paper that's going to be agreed by your cabinet tomorrow. And I just wanted you just to offer me some assurance that that plan, which I've not seen any race equality analysis linked to it, but I just want you to give me some assurance that Black citizens have been meaningfully and, you know, proportionately consulted in that document, please, because I am concerned.
Tim, the equality diversity assessment as part of the plan will be judged against each of the objectivity in there. So that will be in there as part of the plan and it will be judged by that. As far as the statistics are concerned, you will recall that I said there's a fair percentage of our staff that do not record their ethnicity. So we can't say those stats are correct or otherwise.
Well, 20%, sorry, Mayor. I mean, I've had the privilege of working for the NHS for 20 years. You wouldn't believe that, but in the NHS, right, the declaration rates is in the high 90%. Now, in Doncaster Council for the past 25 years, right, you've had a non-disclosure rate of 20% and nobody's done anything about it. I find it deeply offensive and very upsetting. You've got colleagues in the room who also work in the NHS. There's something called Workforce Race Equality Standard, right? And as I say, every NHS organisation in the country is encouraged to have a declaration rate of 95% plus, and if they don't, they are being held to account. Why is it in Doncaster 25 years, year on year, the declaration rate is low 80%? It's not acceptable. And you could easily do something about that by just having a simple audit.
Mayor, you're on mute.
Looks like Ros had frozen.
I actually lost most of what Mr. Brown was saying. In truth, my screen went just totally blank. So I've just come back in again. So my apologies for that.
Tim, you're on mute again. Tim, you're on mute, sorry. You're still on mute, Tim.
So,
Can I suggest we do a written response to that, please?
I was going to suggest that. If David, if you've got all the information that Mr. Brown's put down, let's do a written response, because I missed quite a lot of what Mr. Brown must have been saying. I was totally taken out of the meeting. So can I therefore move on?
Consultation. It was whether or not you've consulted with any black citizens or group in the context of your renewal plan that's going to the cabinet tomorrow, Mayor, because I really am concerned about any lack of consultation on this document.
The plan will have gone to Team Doncaster, where we have representation. Dolly is on there representing, and I think Akila is. But let us give you a written response, Tim, for the other things, because I missed much of what you said.
Okay, thank you,
Tim.
Thank you.
Thank you. So can we go on? So I will now ask, hopefully I'll not get cut out this time. Ms. Jones, would you like to ask a supplementary question, please? Olivia.
Hello, can you hear me?
Yes, I can. Thank you.
So just sort of following on from what Tim was saying, which community organisation, what community sort of black-led community organisations would you be reaching out to in terms of getting this information? I know that you're speaking to Team Doncaster, but there are, you know, you're saying about intersectionality, there are different black communities in the area, so you couldn't just, I don't think it would be appropriate to speak to just one, because they reach out, there's so many different legs.
I believe Dolly's team reaches out to many different communities, but we will get the list that the information is going out to, and as I say, it's not fully approved as yet.
No, that's
okay.
Releasing the list of the community organisations that you've spoken to.
We will certainly produce a list of the organisations that we consult with.
Thank you.
Okay, and Arnold, please.
Mayor, my question is still down to sustainability and so far actions taken to resolve this pandemic and this high mortality rate. Sustainability, I can see from the report on that a 2-year program has been commissioned, and in my question, the BME needs assessment came before the COVID recommendations, even though they are certain intersectionalities, that's commonalities between the two. So my question is, the 2-year, the funding for the 2-year project, is it coming from the post-COVID fund, or is it going to be, is it coming from a mainstream DMBC fund? And if so, after the 2 years, are there plans to keep that rolling? Because, sorry, it's just, I think we've passed the stage of understanding the problem. We are at that stage of the problem is here now, and it's about pledges and actions taken, because the model highlighted so far are not effective as such. If it's a business, it's failing. And what we're saying is, what are we supposed to do as a business or as an organization to make this problem look as if we got a solution for it?
Thank you, Arnold. I'm going to ask Dr. Rupert Suckling, because he's actually running the whole of the programme, and it is over a 2-year period. Rupert, would you like to come in, please?
Yes, thanks, Ros. So we are funding the posts initially from the Test and Trace grant. So all local authorities have been given a Test and Trace support grant. We're trying to seek clarity from the government as to how long this grant is going to be with us for. We have profiled the resource over the next 18 months, so up to March 2022, and that's an initial starting point. At the moment, the observation is correct that there's no sustainability built into those posts, but that is something that we would need to look at over the next 12 months. Some of that is the fact that the response that may be required, it may not be from an additional post or additional specific services, but actually may require mainstream health services to change the way that they are accessed and support people from different ethnic groups. But that's the starting point, and we'll talk more about that at item 7, if that's okay, Mayor.
Thank you very much for that, Rupert. So thank you all for your questions, and I will actually get the response that haven't been given to you, Tim, as soon as I get all the information that was said. So we'll move on to item number 4, which is COVID-19 national overview, and this I'll ask Rupert to actually present this item, please.
Yeah, thanks, Mayor. So, I mean, Tim Brown's already said this in terms of the sort of World Health Organization. The World Health Organization have declared the COVID pandemic as the biggest challenge that they've faced as an organization. And if you think they were formed in shortly after the Second World War, it's a major challenge. Nationally, we are data up until the 21st of July says that we've had over 250,000 cases and over 40,000 deaths directly from COVID. If you look at what's called excess deaths, so this is deaths where COVID may have made a contribution because of the way people maybe have accessed services differently, that 40,000 goes up to 60,000. We're definitely in the downward swing of the first wave, although in that last week of data, there were still over 4,000 new cases in the country and just short of 500 deaths. So that's about 1% of the deaths over the whole pandemic we've still seen in the last period. The main things that have been happening across the country have been increases of new cases seen particularly in the Northwest and in the West Midlands, and people will have seen the increased attention on Blackburn and Darwin in the Northwest as they have seen increased numbers of cases. The number of cases that we saw in Leicester is still high but is falling. So what we see now across the country is not one pandemic really where everyone is affected equally, is we're seeing outbreaks and clusters of disease. To support the sort of overall approach to address cases, clusters and outbreaks, the government's done a number of things really, and they relate to 2 main policy initiatives. So one is the publication of their next chapter guidance as part of COVID response, and that includes advice on how we might continue to suppress the virus, how we might continue to open up the economy further, about how we might plan as a country to rebuild, and then also finally is about how we might prepare for winter. And if you think this winter we might only have we have COVID, we might have seasonal influenza. In this part of the world, we'll also be conscious about the impact of flooding, or the potential impact of flooding, and we've also got EU exit to contend with. This winter is a major set of challenges. Together with the next chapter, Ros, the government produced something called the Contain Framework, and that included the list of powers that local authorities may use to contain local outbreaks. So many of those powers default to the Chief Executive and the Director of Public Health. However, locally we would want to do that together with political consideration and buy-in too, Mayor, if that's okay. And then we are still seeing updates in terms of I suppose updates to guidance and policy changes. So in the last week, we've seen updates around how care homes may open themselves back up to have visitors for their residents. And then in the last sort of 24, 36 hours, we've seen what's now known as a handbrake policy on the quarantine should people be in Spain and returning to the UK. So although what we're seeing is a reduction in the number of cases and a reduction in the number of deaths nationally, we are still seeing changes to government guidance in terms of frameworks and rebuilding, together with some very rapid decisions being made about individual policies, and we will see that continue. So I suppose as we go on to the rest of the agenda, it's just to be mindful of that's the context that we're working in. It's still quite a volatile and uncertain situation, and a volatile sort of a changing set of policies and policy instruments. But that's the key national update, Ros.
Thank you for that, Rupert. I've just noticed David Taylor's hand. David, did you want to come in?
Yes, Mayor, just to let you know that George Tor is now in the meeting. That's all it was.
Okay, thanks very much for that. So I will now ask board members to indicate by raising their hand if they wish to ask any questions in relation to this item. And can I remind members to mute your microphone when you've concluded speaking, please? So if you can raise your hand if you have any questions to ask of Rupert, please. No one is raising their hand, so I assume everyone's got all the information they require. So I therefore go on to item 5, and it really is what the data's telling us. So the person, if it's John or whoever standing in for John from Policy Insight and Change Team, to present this item, please.
It's Laurie Mott from the Policy Insight team. I'm here instead of John. I'm going to share my screen so I can show some of the data and it's slightly clearer. I just need someone to confirm when they can actually see it.
Yeah, we can see it, yeah.
All right, thank you. I'm just going to run through what we currently know and, as of course, happy to take questions at the end. The shielded population, those people who should be taking particular care during this period, the number in Doncaster is just a shade under 18,000. That's just under 6% of the population. But as of the 1st of August, the guidance on for those people will be relaxed so that the extremely clinically vulnerable people will no longer be advised to shield in the same way. There may be some details in the policy of that I'm not aware of. That's my current understanding. We usually get an update on the shielded population every week, but we haven't had an update since the 31st of July. My guess is we probably, sorry, it's 31st of June. I do apologise. It's not 31st of July. I haven't had that yet, have we? So as of the moment, I don't think that number is going to increase. If I go on to community infections, as of yesterday, we had 2,023 confirmed cases of COVID in the borough. And at the bottom of that slide, I hope you can all see, there's the number of cases that have happened or occurred in Doncaster week by week since the beginning of March. And what I think you might not be able to read the key at the bottom, but since the beginning of May, the number of new cases has, on the whole, been falling quite consistently week on week until really very, very recently. The rate that has been getting a lot of people quite excited is the 7-day confirmed case, which is the number of cases per 100,000 across the whole borough. The latest rate that's been reported, which is for the period 18th to the 24th, is 3.9 per 100,000, which is the lowest it's been since they've started measuring in this particular way. And if you look at the graph at the bottom there, you can see that it's been falling dramatically since the middle of June. So at the moment, that's looking very healthy indeed. Just to move on to community transmission, the total number of confirmed cases reported to the NHS Test and Trace programme from Doncaster is 549, and there have been just over 900 contacts identified through that programme. Within the borough, we have 4 active incidents, which are currently all of them being maintained, and there doesn't look at the moment with any of them that there are going to be any more cases in any of those incidents, and indeed 3 of them are going to be closed by the end of this week. There are 2 more incidents that have appeared today, but they're currently being investigated because we don't know for sure whether they actually are COVID related or not. There is currently only 1 care home currently considered to be an incident, and that will be closed on the 31st of July, unless of course there's a further identified case in that home. But I think for the past just less than 2 weeks there's been no additional cases there, so I think people are fairly hopeful that that incident will also be closed very soon. In terms of the hospitals, which of course was a huge concern 2 months ago, the bed occupancy rate is now 14. So in other words, there are 14 beds currently being used at DBHT for patients with COVID-19. That's the lowest we've had since March. There are currently no patients in intensive care. And the last admission was on the 21st of July. And then the numbers of deaths, which Rupert was referring to earlier, locally, there have been, as of the end of the 10th of July, there had been 260 deaths from COVID-19 in the borough. That data, which comes from Office of National Statistics, is always a little bit behind the fact because they have to process the data. According to our local registrars, the last death we had in Doncaster of COVID-19 was on the 18th of July, and I received today a report that DBHT had reported a death on the 24th of July. But what you can see, if you look at the chart in the bottom right of the screen, you'll see that the number of COVID deaths, which is the blue bar, have been falling fairly dramatically. And in fact, the week ending the 10th of July saw the smallest number of deaths from COVID-19 we've had in Doncaster since the outbreak began. That's everything I was going to cover. I'll hand back to you, Chair.
Thank you, Laurie. So, board members, if there's any question you wish to ask, can you raise your hands, please? So I've got Damien first and then Nuala. So Damien.
Yeah, thank you, Chair. It would be helpful for the board to appreciate Laurie, what the context of the information around incidents and outbreaks was. Whilst we can recognise that the cases per 7 day, 100,000, how does that contextualise against, for instance, the rest of Yorkshire and Humberside, and what would indicate a level of concern or a threshold of concern? I know we're going to touch on the item on the outbreak plan, but it would just be helpful, I think.
Yes. So, sorry, you cut out slightly at the end there, but I think I got the gist of what you were asking. I think in terms of the case rate, 7 day rate per 100,000, I think the threshold we were worried about was 20 per 100,000. So as you can see, we're well below that and have not come even close to that for at least 3 weeks, I think. In terms of comparison to other places, in terms of South Yorkshire, Doncaster, Barnsley, Rotherham, Sheffield, our rate has on the whole been lower than those at places and has remained that way for most of the last couple of weeks. There are places in which the rate is now 0. That's not the case in Doncaster, obviously. But at the moment, it seems to be continuing to fall, which is obviously a good thing.
Thanks very much, Laura. I don't know whether Rupert wanted to add anything to that.
I suppose I just wanted to comment on the incidents, if that's okay. So Public Health England publish the number of outbreaks in local authorities, and for the last 4 weeks we have no outbreaks as defined by Public Health England. What we do with incidents, these are cases where we have either single cases, but they happen to be in workplaces which we would have be worried about more cases, or whether there's potential for 2 or more cases, so people who maybe have symptoms who then turn out to be negative, but we wouldn't want to see those cases turn positive. And for incidents and outbreaks, what we see across South Yorkshire is that we have a lower threshold for calling something an incident, and I think that's the right thing to do. So is to have a low threshold for incidents, because that means that we are then tracking the results of any COVID tests. We also then gives us the opportunity to work with businesses or other settings to make sure that they are COVID secure. So I think Laurie's right. Whilst the numbers show that we have a lower rate of cases than our South Yorkshire colleagues, we actually have a higher number of incidents, because we don't wait for it to become an outbreak before we note that. But we don't have any data that compares that, Damien, because every area measures their incidents slightly differently.
Thank you for confirming that. It's really helpful.
Nuala?
Yeah, just a quick question, actually. One of the things that I've been asked from quite a lot of people is, obviously they can go on and they can look at the national statistics for Doncaster, and they get some of the statistics that you've been giving us. But quite a few people have said to me, as this is going down, how are the NHS going to get back to what might be the new normal? Because obviously they're looking at the less and less people being taken into hospital, and see that functions are not being taken back up again, appointments and other things. So I think part of all of this, I don't know if I'm asking the right question to anybody here, but would be that the general public, I think, would be interested to know how this is going to step back up again, and as it steps down, how we're going to evolve back into what will be the new normal for the NHS. Because we have very little people in our... We have no one in ICU, according to the slide. So how is that going to affect how we move forward over the next, weeks and months?
Ros, do you want me to?
Yes, please, Jackie, if you would.
Thank you, Jackie.
Neil, I can't give you a huge amount of detail on that, but because we are working on the recovery plans at the moment, so there's a huge amount of work going on to step back up. But some of the it's not going to be like it was because of the constraints around PPE, etc. That's not going away yet. So, for example, we're just about to start the flu campaigns, and we're starting to look at how we can really step up on a vaccination programme. But just a bit of context, it usually takes between 1 and 3 minutes to vaccinate an individual with a flu vac. With the constraints of COVID, it's between 12 and 15 minutes. So that's some sort of context to give you. Now, the other thing as well is, and it's in the local press, well, it's in the national press today, there's been some changes in isolation policies, which will really help, because if you were going in for planned procedures, you had to isolate for 14 days before you went in. And there's been some changes to that as well, so that we can start actually getting patients through the system. But we're actively working on recovery programmes at the moment with the Trust. In fact, we've got a peer review with Sheffield tomorrow to compare our restart plans with Sheffield, just to make sure we're not missing anything. It won't be the same, but we will start to see planned activity starting to get moving again. But I think, you know, I think we can expect that it will be a challenge getting back to where we were at the end of February for a while.
Yeah, thank you.
Thank you for that, Jackie. I've got no other hands showing. Can I just check with you, David, that that's the case?
Yes, Mayor, that's I can't see anybody that wishes to speak.
Okay, thank you very much. So with that, can I ask you all to note the presentation that's been done, please, by Laurie? Thank you. We move on, therefore, to item 6. And again, it's Rupert, the outbreak plan, please.
Thanks, Ross. So one of the key things is how do we respond where we have cases, and how do we open the borough and keep the borough open? So nationally, the NHS test and trace system was launched in May, and in the middle of May, local authorities were asked to develop a multi-agency outbreak plan. It needed to cover 7 particular areas. So that included how we might respond to outbreaks of disease in care homes and schools, in other high-risk areas, but also how we might support NHS test and trace to do complex contact tracing. Also needed to include something about how we might support people who needed to self-isolate and needed humanitarian support, and then needed to identify how we might use the various data feeds that we get to plan for the future, to make sure that we got adequate local testing and that we'd got an effective governance system in place. And what this plan does is just outline how we do how we address those 7 things. It's worth saying that behind this plan is a much more detailed plan that has individuals' names and contact numbers for some of the key elements. The key things to draw your attention to in the plan are the 3 sort of groups and meetings that we now have in Doncaster. So as well as this oversight board, we have a COVID control board that I chair, and we also have a daily incident management team meeting. And it may well be that in future, as a board chair, you would want to see the minutes from the COVID control board that I chair. And that's something, if you maybe at the end of this, you can come back and as a board decide whether you'd want to do that. We talk about how we use data and intelligence, and can report as of Sunday, I now have access to individual level data for new positive cases in Doncaster. So that is something that is a major step forward. In the plan, we identify the high risk groups, settings and places that we feel we need to have bespoke plans to not only prevent cases but also to respond to cases or outbreaks. We address how we might do contact tracing, and in fact in Doncaster we have done 2 episodes where we've done enhanced contact tracing linked to previous outbreaks in care homes. We also describe how we might do testing. So it's worth reminding ourselves that currently in Doncaster people can access the regional testing centre at Doncaster Sheffield Airport. We also have a mobile testing unit that operates most weekends at Durn Valley Leisure Centre, and if we were to have outbreaks or communities with high levels of COVID, I have the ability as Director of Public Health to bring in a mobile testing facility should we know that. The plan also then describes some of the broad outbreak prevention and control measures, a broad approach to communications and a broad approach to resources. So that's the key outbreak plan. I think one of Mr. Brown's supplementary questions was about equality impact assessment of the plan. So there currently isn't a equality impact assessment of the plan, and that's the main reason is that we haven't conducted an equality impact assessment of any of our emergency plans. That's not something that is usually done. However, I do think in this case, given that this plan has got to address the particular needs of communities that are impacted by COVID, that is something that we should do, and I think we should bring that back to a future meeting of this group as well, so that you can see that not only has this addressed the challenges of COVID for particular ethnic minorities, but also we're starting to see some challenges around the impact of COVID for pregnant women, amongst other groups. So I think we ought to do that and bring that back for your agreement. But that's the key update on the public-facing outbreak plan, Ros.
You're on mute, Chair.
Damien, I've got your hand up, and then Jackie. So Damien first, please.
Yes, thank you, Ros. Just to support Rupert's proposal that we should bring the minutes of the COVID Control Board to this board for oversight, and it therefore enables those to be transparently put in the public domain as well. And the second point, because the nature in moving from a response to a recovery, we have done impact assessments, and the very nature of an outbreak control is that it's looking at the impact across a number of different groups, means that actually that's core to the impact assessment of the response as well as the recovery as well as the response. And we have said that each of the objectives in the plan will have equality, diversity and inclusion at its core. It enables us then to hold to account. And my proposal, Chair, would be that the Fairness and Inclusion Forum pick up some of that responsibility to hold us to account in ensuring that that actually takes place. That way you've got a degree of arm's lengthness in bringing the challenge.
Thank you for that, Damien. And as we've got the Chair, Fairness Inclusion on, we'll actually put that in writing, because we want it to be there, open and transparent, and to be held to account with what we're putting forward. So thank you. I've got Jackie next, and then Fiona.
Thanks, Ros. It was just a point really on the bottom of page 15 in the high risk settings, Rupert. Is this our list or is it a national list? Because care homes weren't on the list, and I just thought, are they included in one of the others? I wasn't quite sure where they'd fit, but it seemed like they were sort of a group worthy of their own bullet point, really. Yeah, okay.
Rupert, are you able to answer that, please?
Yeah, we'll make sure that that's explicit in there. So they do have their own, we do have a plan for outbreaks in care homes. So that's helpful, Jackie. Thanks for spotting that.
Thank you. Fiona, please.
Hi, it was just to say, when will the education setting protocol be available, and to what extent will that kind of factor in the local approach that we've seen in Doncaster so far, as opposed to, you know, just kind of taking on wholly and only the government approach?
Yep,
Amy,
thanks.
are you able to pick that one up, please?
I can answer that one, Ros. It's Rupert.
Oh.
So the way that the approaches for those settings work, they're developed really on 3 inputs. So the first input is a standard operating procedure, which has been developed by Public Health England in Yorkshire and the Humber. So there's a standing operating procedure. The second input that we will get from it is a set of national action cards, which we from a new organisation, the Joint Biosecurity Centre. But the most important input is a local planning grid. So for education, that's been led by Rihanna Nelson, Leanne Hornsby, Paul Ruane, working with local education providers, and I hope, Fiona, you have had some involvement with that. And we certainly see the local planning sort of grid taking the priority, being informed by the national resources, but where the national resources don't make sense locally, we wouldn't rip our plan up and just use a national approach. So the local planning grid is the key approach, and so we've been through a number of those over the last 2 weeks in the daily incident management team, and on a Friday at the incident management team we do a lessons learned review, and we will use that to update those planning grids. So that's the way the grids are put together, so they should be locally owned. The one that we've just worked through today was around places of worship, and that's particularly important given that it's Eid on Thursday as well. Okay.
Thank you.
The next I've got is Dolly. Dolly, would you like to ask your question, please?
Thank you, Rose. Basically, what I wanted to say was what Rupert just mentioned about the places of worship and faith communities, because we know measures are being eased off now, and with faith communities, there's the understanding that God is there and God is going to protect, and they're kind of going to minimize the impact. And as they go back to the places of worship, the sitting arrangements and the meetings together, it's going to be an issue. I had that experience, and I had to say to people that if you don't put your mask and things, you won't be able to come in. But some people are like, they're covered, they're safe. So what measures can we put in place? I know there are a lot of things going on and information, but how are we going to monitor that, you know, we ensure that people are actually safe once these faith organizations are fully operational? Thank you.
Thank you, Dolly. Rupert?
Yes, so the way that we've tended to work with the faith organisations has been on a one-to-one basis through our communities team in the council. That has got a lot of strengths in terms of individual relationships with places of worship, particularly through the communities team. However, I do think there is a gap in Doncaster in terms of a faith sort of communities sort of gathering. So some while ago there was a faith sort of group led by, I can't remember his name, Ian, who then went to Manchester, and I think there is a gap that we ought to think about. How do we want to work collectively with the faith sector? Otherwise we are very reliant on those individual relationships, or for some of the, I would say, the more established faith sectors, their relationship with any national bodies that they have. So either the the National Council of Muslims or mosques, or diocese, the local diocese for some of the Christian groups. So I think that faith group is an area we want to sort of reflect on, really, and think about whether we need a more well, I'll call it a sort of strategic, but maybe a more coordinated approach with our faith communities, particularly coming out through, as you say, Dolly, through COVID and the impact.
Thank you. David, you've got your hand up. David?
Yes, Mayor. Sorry to interrupt once again, but I've just texted Andy Pickering, and he sends his pathologies. His mum's been rushing to hospital, so he was going to attend, but I've just received his apologies for the minutes.
No problem. Thank you for that, David. And therefore, no one else has got their hand up, colleagues. And therefore, can I ask members to agree with the amendments that's been identified, the proposals that beat the outbreak plan? Can people?
Agreed.
Agreed.
Thanks very much. So therefore, colleagues, we're going to move on to item number 7, and it's Rupert again. And can you present this, Rupert? It's supporting our ethnic minority communities. Over to you, Rupert.
Yep, thank you, Mayor. So this picks up on some of the questions that we had earlier on. So they do relate to the 2 reports that Public Health England wrote in relation to the impact of COVID-19 on people from different ethnic minorities. First report was a sort of data-driven report, which showed that particular groups had higher mortality from COVID-19, so particularly Bangladeshi men and then black men. There's still a debate going on in terms of what actually what are the reasons for that, and they include debates around as well as ethnicity. Is it the sorts of occupations that people are in, so particularly key workers? Is it the housing that some of those groups are in? But whatever the sort of true story is, it's definitely a fact that although initially COVID-19 was said to affect everybody the same, there are groups that are disproportionately impacted. The second report included feedback from some of those groups, and again there was quite strong evidence about the impact. Public Health England write their reports for government to consider. However, we took the view locally that we wouldn't wait for government to respond about what they would do. We would assume that Public Health England had written the report to us in local government as well. And therefore, what we've done is we've taken the recommendations in that report and proposed, subject to the board's agreement today, that we should respond to those recommendations as if they were to us. So those recommendations include to do further work about the data that we collect, so ethnicity data collection and recording, some work around participatory research with the communities to improve access and experience and outcomes for people from ethnic minorities, to develop culturally competent, not only occupational risk assessment tools, but also the COVID-19 education campaigns. We also want to increasingly have more culturally appropriate health promotion, disease prevention campaigns, and through that address some of the wider inequalities. We also want to take the opportunity of, I suppose, I was going to say re-envisioning, but actually sort of bringing back some of the outputs from the BME health needs assessment, which again was mentioned in some of the questions. So particularly where we have previously identified Egyptian traveller groups, and access, particularly around primary and secondary care, to be a challenge, we would want to review that progress and see whether there is more that we can do, given the new ways we've got of working with our health partners. So, the development of primary care networks and the experience, I suppose, that we've had with working with partners on COVID, we think we could make more progress. So instead of waiting to see what government does with the recommendations from Public Health England, we think that local government should work with our partners to make progress on those recommendations. Well, so that's the proposal.
Thank you, Rupert. Jackie, your hand's up.
Thanks, Ros, and thanks, Rupert. I completely agree. And one of the things that I'd written down on this report, so it's on page 38, it talks about the primary and secondary care access to services. When I looked at the actions, I thought we could do a lot more there. And the comment I'd got is, can this section be broadened? Because personally, I think it needs to take account of community, social care. Even though it talks about acute and secondary care, it doesn't talk. None of the actions seem to really be associated in any way. So I think there's a real opportunity to strengthen that a lot. And then just on page 35, if it's okay to mention this now. In the middle box, it talks about that set up a staff group in Doncaster Council that represents and engages with our BAME employees and other employees who experience inequalities, which is obviously a great idea, but a lot of the Team Doncaster organisations have also got those groups, and I just wonder if there's an opportunity also to bring those together and have a much more strategic approach to this topic in Doncaster as well. So not only have our individuals, but get the force of us all together as well. Yeah.
Thank you, Jackie. Rupert, do you want to pick that item up? And then I've got Jane, who's indicated she wants to ask.
So that's really helpful. I'll take both those suggestions back, Jackie. Thank you.
Thank you, Rupert. Jane.
Yeah, it was just a question for Rupert, really. We talk a lot about engaging with faith groups and lots of different groups, but being mixed race myself, I don't fall into any of these groups. So I just fear there's probably, I'm guessing there's not that many of us across Doncaster, but there's certainly a few who don't seem to fit in any of these slots. So I'm just concerned that there's than it would a normal white person. So I don't know what the answer is to that, because I don't know where we all are, but we're about somewhere. So I think it's just a thought we need to have.
So I think that's where, certainly for, if you think about the item we've just done on the outbreak plan, where we want to look at the equality sort of impact assessment, mixed is still a group that we would want to make sure that the plan addresses. And I think what we would need to think then, broader for ourselves is how this fits with the BAME proposal. I'm happy to pick up outside, Jane, if you've got any bright ideas. But I mean, you're right. If you look at some of the data, we have, still got a significant percentage would say that people would describe themselves as mixed heritage or mixed race.
I think there's lots of us of a certain age. Yeah, absolutely. Yeah.
If you pick that up, and I noticed Olivia was asking very similar questions, so we really do need to list all the differing BAME communities, BAME communities that we're actually in discussions with, so that people can see that it's as wide as possible. I haven't got anyone else's hand up, so from that, can I ask board members to actually indicate by verbally saying that they're happy with the presentation by Rupert and the proposals with the amendments highlighted? Or Rupert, your hand's going up.
You're on mute, Rupert.
any better?
Yes, we can hear you now. Thank you.
Yeah, I suppose, I mean, there is just something that's come out of the conversation with Jane, and I think Tim Brown's put something on in the Teams to David Taylor, just about, I suppose, language. So, you know, I know there's a live debate about, you know, is BAME the right terms? Do people want to use term black or mixed race, or how that is? So I think there is a whole set of work for us to do to agree some of the right sort of language, which we can only really do with people, you know, as you know, Olivia sort of mentioned earlier. So I think sometimes we sort of run ourselves in knots trying to get the language right, and probably always end up offending somebody. So I think getting the language right on some of this has got to be a key action too, Ros.
Thank you for that, Rupert, and we will always endeavour to get the language right as well, because it is not our intention to offend anyone. Okay, and therefore people happy with that, because I'm going to move on to item 8, terms of reference. And the report is for information only. I'm just asking any members if they wish to speak on this item. If so, please. I've got Rupert's hand.
Yeah, thanks, Ros. So just to remind people that the board was set up as part of the response that local authorities were asked to make in terms of COVID. So, which is why the terms of reference currently are really focused around the infection. So, you know, in terms of providing oversight assurance around outbreaks and about actions to manage outbreaks, to engage and communicate with residents and stakeholders in terms of what's happening, and then to monitor the levels of infection, which I think we've done this afternoon. I suppose the thing I would say, Ros, is with the restart, renewal, recovery plan, there are broader challenges in terms of Team Doncaster, in terms of what's the sort of, I suppose, the meetings and what's happening where. And it may well be that there are other areas under the broader restart, renewal, recovery that you would feel appropriate to come here. And certainly, you know, just thinking about the members of the board. So we've got Dan from the Chamber, and obviously the broader impact of COVID on businesses, the impact of COVID on the town centre and the public realm is quite important too. So the terms of reference reflect the minimum that we were expected to do by central government. But as we've done with some of the planning and made it fit for purpose for Doncaster, I think there's something we will want to consider over the next sort of few meetings about whether there are other items of business for Doncaster that it makes sense to come to this oversight board. So it may not be directly related to COVID, but indirectly, most things are going to be related to COVID over the next 18 to 24 months.
Thank you for that. I've got Damien's hand up. Damien?
Yeah, thank you, Ros. It was really picking up on the point that Rupert's making. Obviously, in the wider team, Doncaster are introducing a new operational model, and a number of those individuals that Rupert cited will be sitting on the gold, currently named gold group, hasn't yet met. First time this week in its new form, and there'll be issues there which will have a COVID theme to them that the board will want to escalate. So I think identifying, when the remit was put together, we hadn't got the structure outlined in as much detail. It would be helpful to specify, I think, and to keep under review the terms of reference as we move forward with the rest of the Team Doncaster operating model.
Thank you for that, Damien. And we should always keep the terms of reference and the people actually participating under review as it's identified to us. So with that, are members happy to agree with the proposal, please? Could I please hear voices?
Agreed.
Yes.
Thank you.
Agreed.
Thanks very much.
Great.
And therefore it brings us to item 9, which is dates of future meetings. Again, over to you, Rupert.
Yep, so You should have a set of dates of future meetings in your diary. We will send them out with the notes of the meeting. Just for board members, the administration is moved now to Democratic Services, so that's where you get your invites from, rather than Claire Hewitt, who originally set these up. I think the next meeting, I'm going to say the 17th of August, David. You'll now correct me, won't you?
I'll have to check, Rupert. What I was going to say was that, as you rightly said, that Claire sent the invites out, but members will not realise it's got no telephone number and code number on. So I'll leave them in for now, but closer to each meeting, I will remove that invite and send a proper Microsoft Teams invite that anybody can access.
Sorry, it's the 18th of August is the next one.
Yes, thank you, Rupert. Thank you.
I've got Damien's hand up again. Damien?
Yeah, just to clarify, given that it's moved into Democratic Services, the usual timeframes for publishing agendas and minutes and associated papers will also go along with that as well.
Thank you for that. Rupert, did you want to come back?
Yes, I suppose. Yeah. So agree with Damien's point about the note, the papers being available in advance. I suppose the other thing was just thinking about the public questions this time. So we could bring this meeting into line with Cabinet and Council, where the response is given before the meeting to public questions. So we can work with Democratic Services to align that if you want.
It would seem sensible, and no problem with people wanting to listen right the way through the meeting. It's always the right thing to do. But if people want to ask their question and may need to go for other reasons, putting it higher up on the agenda may help people. So yes, thank you, Rupert, for that one. So with that, I believe that we've concluded the whole of the agenda. So it just leaves me to thank everyone for their attendance today and for their input. And with no one else indicating at all, I will close the meeting. Thank you very much for attending.
Thank you, Chair.
Thank you. Thanks, Chair.
Thank you, Ed.
Thank you.